The Nigerian Medical Association (NMA) Ekiti State has threatened to shut down all public health facilities in Ekiti State if the federal government failed to accede to the demands of its national body over the withdrawal of a circular on proposed upward review of allowances before the 21 days ultimatum issued by the national body.
Notwithstanding the intendment of the circular, it is important to state that it was in flagrant contravention of the previous collective bargaining agreements that emphasized the existence of relativity in the remunerations of doctors with other healthcare workers. What we have seen clearly demonstrated is the insensitivity and the hypocrisy of government officials to keep to terms with the agreements previously entered into with the Nigerian Medical Association.
Dr. Reyemi condemned the statement made by a government spokesman on national TV, where he alleged that former President Muhammadu Buhari would have died long ago if he was treated in Nigeria, stating that such statement was reckless.
A good number of Nigerians that travel for healthcare services in the UK, Canada, Australia, currently even in Germany and Denmark, get to meet with specialists that are Nigerian trained from Nigerian institutions that were trained in our own universities, but had to leave the country for the opportunity to get the best of trainings for themselves. And that is why they are over there in those countries. And they are the ones taking care of our own politicians who now escape over there to go and access care. Whereas leaving us and the generality of the populace to now be managing what is not enough and what is not even present in our hospitals. And you are expecting a miracle to now happen through the doctors that you are not training properly, you are not remunerating properly, that you are not giving enough equipment to work with, and more importantly, that you are not motivating properly.
Dr. Reyemi explained that doctors deserved better welfare packages.
By the time you have to spend more than 80-90% of your earnings to even write exams, to pay for basic amenities like light, a doctor cannot even afford a Tokunbo car anymore in Nigeria. And yet you have to work more than 16-17 hours a day. How do you get back home? How do you get back to work? These are issues that are now contending with medical care and the practice of medicine in Nigeria that is making our people live in droves. More than 2,000 doctors left the country last year, young doctors. And that is going to create a crisis for us soon. Because the more people that are retiring, the older doctors are leaving, we cannot replace them. The skill that they are not able to transfer to the younger doctors would show, and we would not have enough people to cater to the teeming health needs of our population, both at the local level and at the national level.